Alright, in this video presentation, we're going to be talking about the different types of laboratories. Now, there are many different types and locations of medical laboratories based on size, capability, and of course, affiliations. And we're going to be looking at all three of these from different types of labs that exist out there, from independent, hospital-based, and so forth, specialty labs. So let's just get started. Now, start with independent laboratories. Now, these are located within a medical center or a large clinic. And of course, they also have small satellite patient service centers for patients' convenience. And with that, they receive samples from general practitioners, insurance companies, and of course, other health clinics for analysis. And basically, specimens are collected and then taken back, usually by courier, back to the central lab for processing, such as LabCorp, Request, and so on. So again, these are independent, different locations, satellite, and they work the same way together. Now, hospital-based laboratories, of course, these are the ones that are attached to a hospital, usually located inside the hospital somewhere, usually on the second floor somewhere, or in a specific location of the hospital. And of course, they perform tests on the patients while they're admitted either in the emergency room, or if they are inpatients. They also have outpatients where patients come in and they can get their blood drawn and leave. But then you have inpatients that are of course, patients that are there in the hospital because of surgeries or ICU, intensive care, labor and delivery. These are different areas in the hospital that these tests can be performed right there. And what happens is the phlebotomist would go room to room, draw the blood, go to the ER, and then bring it right back up to the lab to be tested immediately. So these are the hospital-based laboratories. And of course, tests and results are administered right there in the lab. Now, sometimes there are specialized tests that need to be sent out, which we'll talk about as well. So you might have a specialized test that you can't process there at the hospital, but it will be sent out to get tested somewhere else. And again, these are hospital-based laboratories. Now let's look at reference laboratories. These are usually independent laboratories that are used by hospitals and physicians. Now what that means is that usually you might have a hospital or a doctor who is contracted with a specific lab. Now what that means for the patient is that they can only use those laboratories to get their blood drawn that is only contracted by the hospital or the physician. So these are reference laboratories, and LabCorp has a number of different facilities that are located within a doctor's office that are contracted by them, or even by certain hospitals that the patients can only go to LabCorp based off of that hospital or that doctor. So that makes it pretty much exclusive to them and to them alone. Now let's look at point of care testing, also known as POCT, or also known as near patient testing or bedside testing. Now the key objective of point of care testing is to generate a result quickly so that the appropriate treatment can be implemented. So again, these are bedside tests. The doctor might have the phlebotomist or even an MA go to the bedside of the patient and go ahead and administer this quick test for a quick result. So the doctor can determine if we need some further testing done, either blood related or anything else that needs to be done outside of POCT. So it usually gives the doctor an idea of what's going on right there and immediately, and gives them a direction to go to when it comes to the patient's health. So again, this is point of care testing, or POCT. Now, type of POCT testing might be electrolyte systems, blood gas or ABGs, which is arterial blood gases done. We might have handheld or single-use devices for tests such as urine, albumin, blood, glucose, and also coagulation tests. And again, these are all part of the POCT testing, again, which is right there at the bedside. So these are some of the tests that might be asked to be performed by the physician, and given the order to the phlebotomist or even to the MA. We also have what's called a POL, a physician office laboratory, and this is usually done in a doctor's office, and usually to a lab that's set within a doctor's office. Specifically, somewhere in there might be a lab where the physician or the medical assistant or even the phlebotomist can go and take the blood or do the test right there in what they call a POL. And of course, common medical tests can easily and inexpensively be performed in the office by the phlebotomist or MA. So again, POLs are sometimes common with physicians who own their own office or test center. Types of these might be a cholesterol test using a chem card. We have glucose monitoring testing. We have strip testing, hemocult testing, different types of tests. You have urine testing there with urine strips. So there's different types of POL tests that can be done right there in a in-house office lab. Now let's look at laboratory departments. Now laboratories are divided into departments that will perform special tests. So inside of a hospital, you go to the lab and you'll see different sections of the lab. Now each section is a department in itself that these tests will be run. So we'll have a basic understanding that certain tests need to be run within a certain department within a hospital itself or lab. In independent labs, they'll usually send out their tests to their headquartered lab department, where in their headquarters they might have different sections as well. For example, let's look at the hematology department. Now, tests are performed to assess the components of whole blood, the white blood cells, red blood cells, and of course, and platelets. WBCs, which are white blood cells, RBCs, which is red blood cells, hematocrit, hemoglobin, etc. So hematology is known to run what we might call a CBC, a complete blood count, in which they can break down from a cellular level the components of blood. Just like you see in the centrifuge sample, blood sample on the right, you'll see plasma, you'll see the buffy coat, which is the platelets and white blood cells, and then of course you'll see the red blood cells. These are the cellular components of blood that hematology tests. So if you happen to run a test that says CBC, complete blood count, you draw the blood, usually that would be in a lavender or what they call purple top tube, usually it's called lavender with additive EDTA in it. You collect it and you'll take it back to the lab, to the hematology department to run whatever test needs to be run. And of course, the lab itself will run the test necessary. You will just be processing and delivering it to the lab. We also look at urine analysis department. Now, urinalysis department performs a physical, chemical, and microscopic analysis on urine. You won't be doing this, but you'll actually be collecting the urine from the patient after, of course, giving them the instructions on how to collect their own urine, and whether it be in a sterile, non-sterile cup, or even a 24-hour, 24-hour container with either preservatives or not. And of course, you'll be taking it back to the lab for processing. They will run the tests. Now, sometimes you'll be collecting this in an independent lab station, which you will have to then remove some of the urine and then put it in the proper container so it can be transported to the laboratory headquarters to be for the test to be performed. Either way, you'll be handling the urine. You just won't be performing any tests with it. Now, some of the tests might be glucose, blood, looking for blood in urine, looking for ketones or leukocytes within the urine itself. They will do the test to determine what they're looking for. Again, your job is to handle it, possibly process it, as well as getting it ready for transport. But the lab will run the tests themselves. Also, what we might be looking at is immunohematology department. Now, this is often called the blood bank. And of course, they perform blood typing procedures, cross-matching HIV tests, or even transfusion services. Now, these are also located in the hospitals and in the lab somewhere. It might not be connected to the lab itself, might be just off to the side somewhere, but believe me, the blood bank, it was right there next to the lab. So again, you'll be collecting the blood, properly handling it so we have no contamination, and taking it to the right department. If it's a cross-matching or type and screen, which usually will happen if you have patients going into surgery, labor and delivery, they want to type and screen them or cross-match them in case they start to bleed out. We can give them the right blood. So you might be drawing blood so that they can perform these tests to determine the type of blood that's going to be needed in case the patient needs blood. Also, serology, known as immunology department. Now, they perform tests to evaluate the body's response to infection and inflammation. This is also where tests are performed for hepatitis, measles, infectious mononucleosis, and of course, rheumatoid arthritis. And again, this is called serology department. Again, some of these tests that have to be run might be a send-out test, so they might not be located in the hospital. This all depends on the size of your hospital, the size of the lab itself, and some of these might have to be sent out for specialized testing. A lot of these tests might not be able to be performed within a hospital. Then we also have toxicology department. Now, they test blood for toxic substances. They also monitor drug usage, therapeutic drug levels of medications prescribed, or even the toxicity to the drugs being used. What that means is that if a patient is on certain types of medication and the doctor wants to be able to determine if that medication is working properly for the patient, whether we have to increase the dosage or even decrease the dosage, or want to make sure it's working, then we have to draw the blood and bring it back so that they can run the proper test to determine if the patient's medication is working correctly for them. Now, or if any changes need to be made to the medication. Now, if we do anything to contaminate that blood while we're trying to obtain the blood, that can have an impact to the result or to the test result itself, where the doctor might look at it and determine, oh, the patient has this prescription drug isn't working the way it should. We need to increase the dosage, when in fact they don't have to, or even decrease it when they don't have to, which again can result in patient harm and even up to the patient's death, which again goes back to how the phlebotomist draws the blood correctly so that the blood sample does not get contaminated in any way before it is tested. So this is why it's crucial that we handle the blood correctly and accurately and transport it back to the lab where there's no issue of contamination along the way. We are the mediators, as I mentioned before, that a patient's life is literally in our hands when we take that blood back to the lab, and even when we draw the blood. Now, the DNA department, of course, they provide paternity and maternity of children. Now, these again are specialized testing that might have to be sent out, and these are also very expensive tests. So a lot of tests that are specialized, like in the DNA department, which might not be in a hospital based on its size, will have to be sent out. So then again, we would get the specimens ready for transport, and of course it'd be picked up and sent out to specialized testing where it needs to get done. But our job is to collect the blood so that when it does get processed and tested, there's no issue with the blood itself that could result as a problem back to the phlebotomists themselves. The next department we need to look at is Microbiology Department. Now, Microbiology Department is located pretty much in every hospital. So when we go to the hospital, we will look at micro. We have chemistry, we have blood bank, we have urinalysis, we have hematology, and even a coagulation. And coagulation department will probably be attached to hematology. But microbiology is definitely in every hospital. And of course, they deal with microorganisms such as bacteria and fungi, which are grown in an appropriate medium, cultured, and of course identified. And of course, the microbiology uses culture and sensitivity tests to determine which antibiotics can effectively kill pathogens. So if a patient comes in with a fever, blood cultures will be ordered, which it goes right directly to microbiology department. And of course, they're placed in a container for 2 to 3 days, and of course then tested to determine what is the cause of the fever. So again, microbiology department is located in every hospital, as well as hematology, urinalysis, chemistry, blood bank, and even coagulation. Those are the hands of departments that are in the hospital. The next department we have is parasitology department. And of course, they deal with ova and parasites tests that are performed on specimens such as feces. And they look for eggs from parasites or even parasites themselves. They'll also look for scabies, pinworms, and of course malaria. Now again, you will not be performing these tests, but you'll be actually handling the specimen themselves, processing and probably getting them ready for transport. So again, even though it's not something you'll be doing, you'll definitely be having to receive this from the patient and then getting it ready to be transported to the appropriate lab to be tested. And in this case, parasitology would be the department that any of this would go to. We also have cytology department. And of course, this is a microscopic examination of cells and are performed to detect early signs of cancer and other diseases. Again, these are specialized tests. A lot of these might be sent out. Some of these are not located in a hospital. Cytology department might be a different center in itself for testing these specifics of early signs of cancer and other diseases. So some of these, again, you'll notice are not located in a hospital. Like I mentioned before, there's only a handful of departments that are needed in a hospital. The rest can be sent out. Then, of course, we have histology department, finally. And of course, the histology department, they sample biopsies of different tissues taken from the body for determination of diseases. Again, this is where the biopsy tissues go. Now, again, it's not blood related, but again, you might be handling the specimen or the tissues as they come in to be processed and ready for either to be sent out or to be taken to the lab to be tested. And again, if it has to be sent out, you might have to prepare it to be sent out. It just depends on where you're working. Every facility is different. Independent labs don't ever handle this type of specimen. So if you're working in a hospital, you might, depending where you're at in the hospital, and you might have to prepare it and get it shipped out. So again, these are all different laboratory departments, things you need to be aware of, because depending on where you work and what their policy and procedures are, their guidelines of what a phlebotomist duty is, you'll have to fulfill that role in the way that your employer wants you to fulfill it. So you might not be drawing blood all the time. You could be handling different types of specimens and urines and, again, like I said, sputums and different things that you might not be aware of. But that's part of the job of a phlebotomist. You're working in a lab with different specimens and different things that'll be coming in that are not blood related. You'll always be ready to handle them for wherever you work. They train you and they get you ready. So again, these are the laboratory departments, and you need to understand where these departments are in the hospital or where they are outside the hospital in case we ever have to transport or send a specimen out.